have two different drugs. We have Vidasa, which is a shot, and Dacogen, which is also a shot. But they're administered differently than what you've been on. So they're given 5 days in a row, and then you repeat it in 4 weeks. I know that's a hassle, but I'm kind of at a point where the Aranesp is not doing what it should, and I've got to either be able to try and break the chain to break its suppression of blood production, or we just kind of transfuse you as needed. One unorthodox option is looking at Revlimid, which is a tablet. Doesn't mean it doesn't have side effects. That just means that it's more convenient. And you administer it for 21 days in a row and then off a week. And kind of repeat it to see if we can limit your transfusion requirements. I know this is not something you wanted to hear today.
What is this? Is this trying to kick in the bone marrow to produce blood, or what is it? What are these trying to do?
Well, what it's trying to do is get rid of the bad cells. So essentially, what myelodysplastic syndrome is that you've got a genetic mutation within the cells that make blood, and they typically don't last as long as normal cells that you and I make. And so what you try and do is take out those old cells with the drugs that we're giving to allow the cells that are still functioning normally to produce. Because there's a proportion of suppression of normal blood production as well, because your marrow is getting occupied by these bad cells.
So how low
like
is their
illegal
blood right now?
immigration.
Though they probably already know that,
Yeah.
with the 7 whatever.
7.6.
So how many things of blood does she need now?
Well, what are your symptoms? How do you feel?
I feel pretty good. I'm dizzy today, but I'm not always dizzy.
Yeah, I know. Okay, that kind of goes along with being low.
Yeah, it's the dizzy unsteadiness.
I don't like the dizzy unsteadiness at your age, because I don't want you falling down and breaking a hip.
Yeah, well, I don't either.
What are the side effects of these?
You know, there's mild nausea with this. Hair loss, not so much. It can lower the blood counts before it makes the counts get better. So you have to take out the bad stuff and then bring in the good stuff.
Is one better than the other? I mean, what would you recommend at this point? You gave us 3 options right there.
Or basically, those chemo, a type of chemo?
Yeah, but they behave differently. The Vidasa and Dacogen act the same. Vidasa has been studied and has actually shown a decreased evolution to acute myelocytic leukemia. The Dacogen has not shown that. It has shown that, but the survival advantage has not been demonstrated with Dacogen yet. So the Revlimid is something that I could utilize for, but usually it's for people who have a particular mutation, and she didn't have it. I have seen the data says that even though people don't have that mutation, that you can see a diminishment in the blood transfusion requirements with that drug. It's probably easier to use the Revlimid. The Vidasa has more data to support it. I think toleration of the drugs is dependent upon what people put up with.
What if you don't do anything?
Well, we're going to keep transfusing you periodically.
And how long can we continue to do that?
Well, I mean, I've done it for some patients who are in different situations, similar, where they're dependent upon blood transfusions until they finally pass because they bled to death and from their platelets being low. She's not at that point. What ends up happening is, as you give blood, you end up having less duration of response the more you give, because your body starts making antibodies to all of the different blood that you've given, and so it just doesn't last as long. So the frequency of getting blood transfusion typically increases. It may move from every 3 weeks to weekly. And that's kind of an issue that, that's another 6 hours over at the hospital. It's not convenient, and then you feel good for a little bit, and then boom, you come down. Feel good for a little bit, and boom, come down. And it's one of these situations where this disease is not an easy one to explain. I'm doing the best I can with it.
No, you're explaining it.
But-
Yeah. Yeah.
We understand what's going on. We're just, it's up to her what she wants to do, but.
She don't want to do any of it.
How many pints does she low
really
right
doesn't.
now?
I mean,
Well, I could give her another 2 units. I don't like her dizziness. I'm just trying to get the volume back so she doesn't get so lightheaded.
It's not bad, it's just been happening the last 2 or 3 days.
Right. I think it's gonna get worse.
I mean, I think all of us can see that, like, she has a transfusion, the next day, she's like completely wiped out.
Oh, from the blood
Exhausted.
transfusion?
The day
Really?
after,
Yeah.
she's just like, that was just way too exhausting. And so then
She
the
is.
next day, she's
Huh.
still a little weak and unsteady. And it takes her about 3 or 4 days before she starts feeling perky.
Mhm.
So then she has a week,
Does she get
week and a
short-winded?
half of
Yeah.
perkiness, and she's kind of back to
Okay,
normal.
okay.
And then it's.
But
time.
then we see that 3rd week, we can see her going back down, getting tired and weak again, and we're like, she's gonna need more blood when we go in. We know it before you do the test.
Yeah, yeah,
So.
just based on what she was telling you.
Yeah, I mean, we
You know my marker
we
for giving a
keep
blood
an eye on.
transfusion.
I mean, she sees one of us every single day.